Hello guys, welcome to my YouTube channel once again. Today I'm going to discuss about the HIV or AIDS in case of the child nursing, not in med-surg or something else, okay, or not in community. Let's talk about the HIV or AIDS. HIV is a human immunodeficiency virus. By name only, we can get to know what is the meaning of it, right? HIV mean it's a causative organism, and because of the HIV we are affected means the childs are more prone to get affected with the AIDS. AIDS is stand for acquired immunodeficiency syndrome. The syndrome which is acquired, or sometime it could be the innate, means it could be from the birth also. From the birth also we can know, we can see sometimes the child's also getting infected from the family history, because of the family history or maternal history of the AIDS. That could be one of the cause for AIDS. Okay, means the syndrome is, it is the syndrome. Why it's named as a syndrome? Because it is combined, it is the combination of many of diseases like TB, tuberculosis, pneumonia, and some other diseases like cold, fever, like any other, any nephropathy pathetic diseases, like neuropathetic diseases, different diseases. These all are combinedly named as a AIDS. Now let's talk about the definition. Okay, what is the meaning of what is the definitions of HIV or AIDS? A disease in which there is a severe loss of the body's cellular immunity, greatly lowering the resistance to the infection and malignancy. It's a disease in which there is a severe loss of the cellular body's cellular immunity. After the attacking or attacked with the AIDS, the body's cellular immunity will be lower, and as well as the resistance to infection and malignancy will be decreased. Basically what is happening, because of the attacking of the AIDS to child, the child is getting lowering the cellular immunity as well as the cellular growth and resistance towards the infections, any kinds of infections or malignancy. Next, the children are the innocent victim of HIV or AIDS. HIV or human immunodeficiency virus infection leads to AIDS. It is fatal illness and pandemic disease. It's a fatal illness and pandemic. Mean the because of the getting attacked with the AIDS, the child can get infected with many of the diseases. Okay, as well as the child is more prone to get dead. There is more and more chance that child will be dead at a certain stage of the period, at a certain period of the life. Either it could be taking for 1 year, 2 year, or more, or less than 1 year or 2 year. At a certain stage or at a certain period of the time, the child can, obviously it will be die if the child once attacked with the AIDS. Okay, that is the reason it is calling as a fatal illness and pandemic disease. Now let's talk about the risk factor. What are the risk factor for the AIDS? Advanced maternal disease. Okay, if the maternal disease, advanced maternal age might be a read, or might be a read in the genetic, right? In case of the mother who has married after 35 years of age, there is a more chance to give a birth of a child, the congenital babies. The child will be more abnormality of the child is more chance. means the abnormalities to the child having more chances in case of the advanced maternal disease. So it's one of the risk factor. High maternal viral blood if the maternal blood is infected with the virus. Next we'll see prolonged rupture of the membrane, vaginal bleeding if the bleeding is coming out from the vagina continuously, then it could be one of the risk factor for the AIDS. Next we'll see during breastfeeding. So what's the breastfeeding? How could be it one of the risk factor for the AIDS? So if the maternal or the mother already infected with the AIDS, so his whole cellular immunity, cellular growth, whole cells, blood, lymph nodes, everything is infected with the virus, right? Everything is infected with the virus. So because of the infected virus, so that breast feeding which is giving to the baby, it is already infecting. Now we'll see the causes. Okay, what are the causes? Like HIV virus, human immunodeficiency virus, it is one of the cause for AIDS. Next we'll see the from mother to the fetus, that is during pregnancy, labor, delivery and breastfeeding. So if the mother is already infected with the AIDS, then obviously there is a more chance to get transmission of the virus from mother to the fetus. That could be in the during of the pregnancy, otherwise the labor time, otherwise the breastfeeding time. All these the factors can be one of the causing factor for getting attacked with the AIDS to the child. Next we'll see the blood transfusion. So in case of the blood transfusions from the infected one to the child, then there is a chance of getting infected with the AIDS or attacked with the AIDS. Next we'll see immunocompromised child, that is leading to get infected easily. So if the child, okay, already immunocompromised, how it is getting immunocompromised? So at the time of the breastfeeding mean the time when the neonate and the infant are getting breastfeeded by the mother at a certain period of the time. It could be up to the 6 month, or before the weaning diet starting, or after the weaning diet come starting. Okay, mean from zero to from the birth to up to the 1 year, there is a chance of feeding of the breastfeeding could be given to the child or infant. If the time the child is not getting or the infant is not getting enough breastfeeded by the mother, then obviously the child will be immunocompromised to any kind of infections or opportunistic infection, obviously. Next we'll see the previous maternal history of the HIV. If the mother has already history of the HIV or human immunodeficiency virus, then obviously that virus will be transmit from the placenta to the fetus, or after the transmission or after the delivery also we can see that because of the history presence, that could be chance of the child is infected with the AIDS. Next we'll see the family history of the HIV can also leading cause to AIDS to the child. So family history, if the child's family having any one of having the AIDS, then there is a probability to get spreading the spread get spreading AIDS to the child. Now, and next we'll see the not following or maintaining certain hygienic practices by the mother to the mother or child. So not following, if the mother is not following or maintaining certain kinds of hygienic practices to the child while the child is in diaper, or means the neonate is in diaper, or any anything, if during infant time the mother or child, no, they are not maintaining certain kinds of hygienic practices, then obviously he will be get more probability to infected with the AIDS. Using unsterile needles or the syringes for administering any drug to child. So using unsterile needles. So the needle which is using for the transfusion, blood transfusions or placenta transfusions or any kinds of drug administrations, if it is unsterile, obviously there will be a chance to get infected with the AIDS. Okay, that is all about the causes for AIDS. Now we will see the pathogenesis. Okay, so the causes are completed. Next we'll see the pathogenesis. So because of the etiological factor, HIV or human immunodeficiency virus selectively infects the CD4 plus T helper cells from the other cells in the immune system. When the virus multiplicates, T helper cells are destroyed. Depletion of the CD4 plus lymphocytes in blood and lymph nodes are the important characteristics. As the disease progresses, the functional abnormalities of the T cells may result as an abnormal response of the lymphocytes to antigens. So T cell detect leads to defect in beta cell activity. Results hyper gamma globulinemia leads to failure of antigen antibody formation. So what it is saying, so because of the etiological factors or the causative factors that I have discussed now only, okay, because of the etiological factors, the HIV or human immunodeficiency virus that is directly attacking to the CD4 plus helper cells, which is one of the center immune cell. Okay, if it is infected with any kinds of virus, there is more prone to get infected with any kinds of infection. The most of immune system is broken. Most of immunity is broken by breaking down of the CD4 plus helper cell. So what it is doing, the HIV or human immunodeficiency virus, it is directly attacking to the CD4 plus cell. By that, the virus is multiplicating itself and the T helper cells are destroying because of the multiplication. So after the destructions of the T helper cell, the depletions of the CD4 plus lymphocytes in blood and lymph node could be seen. So because of the depletions of the CD4 plus lymphocyte, we can see abnormal response of lymphocytes to the antigens. So main immune cell, the center of immune cell CD4 plus, which is depleted by the HIV virus because of the multiplication, right? Because of that, we can see the abnormal response of the lymphocytes, the WBC. Okay, so because of that, we can see the hyper gamma globulinemia, the immunoglobulin will be more, the high antigen and antibody reaction will be imbalanced and interrupted, the failure to antigen antibody formation. Because of that antigen antibody formation failurity, the child will be more prone, more chanced to get infected with any kinds of infections or diseases. Understand? So that is the pathogenesis. Now see how the CD4 plus cell. Look at the CD4 plus cell. So HIV virus, which is recepting to the CD4 receptor, and after the recepting with CD4 receptor, it is multiplicates itself. Because of the multiplication, we can see the antigen and antibody formation failurity. Next we'll see the acute HIV infections symptom. What are the symptoms? Like fever, we can see chills, headaches, night sweats, sore throat, muscle aches and pains, joint pain, fatigue, swollen lymph nodes, mainly on the neck, and mouth ulcers. So these are the symptoms. If you're not understanding, it's very easy. You can pause the video and you can easily check it out. Okay, next move on to the next slide. What are the clinical staging? So there are the three staging, like stage 1, stage 2, and stage 3. Okay, so there are three stages: stage 1, stage 2, and stage 3. In stage 1, we can see the asymptomatic symptom, means there will be no symptom, and persistent generalized lymph adenopathy. So lymph node will be infected in case of the stage 1. Next we'll see the stage 2, unexplained chronic diarrhea, means the diarrhea will be seen for a longer period of time. Because of diarrhea, means the diarrhea cause, the person or the doctor or the medical professional is not known. And persistent fever, continuously fever, we can see, means the at a period of the time we can see the fever can be alternate and recurrent severe due to bacterial infection. So recurrent severe bacterial infection, so bacterial infection could be seen. Next move on to the stage 3. So AIDS defining opportunistic infection. Okay, so AIDS defining opportunistic infection, stage 3, severe failure to thrive, progressive encephalopathy, means the encephalopathy means the brain infection started progressing, and malignancy, so the cancer cells start developing. So these are all the stages of the AIDS. Now we'll move on to the complication. What are the complications? Recurrent infection, so the patient or the child will be infected recurrently. Opportunistic infection, as the child is immunocompromised, because of that immunocompromisations of the child will be infected with the, he is providing the opportunity to different pathogens, either it could be the bacteria, virus, different. So the child will be easily infected with any kinds of infection or pathogen. Next we'll see the child will be lost his hearing, tooth and gum diseases, drug related toxicity, mean for treating the AIDS, if the doctor prescribed some kinds of drugs to the child like zidovudine, if it is using for a longer period of time and it is not treating, so the drug toxicity can be seen in the child. Okay, next we'll see the cardiomyopathy, means the cardiac muscles will be started showing some kinds of diseases. Nephropathy means the kidney diseases can be started developing or progressive. Neuropathy means the, as I told in the clinical stage 3, like it is the neuropathy means started developing the brain diseases. Neutropenia means the neutrophil, one of the WBC, so it will be start decreasing in the level. Thrombocytopenia, thrombocyte level will be decreasing in level, and anemia means the hemoglobin level will be decreased. Next we'll see the lab investigation. What are the lab investigations? First we'll see the ELISA, enzyme linked sorbent assay, western blot test. Next we'll see CD4 count test. Okay, CD4 count test, HIV recurrent, HIV cultured HIV sensitivity test. So by the culturing the HIV, we can get to know what is the happen, and HIV specific polymerase chain reactions to detect viral nucleic acid. Next we'll see how we can manage the HIV. Okay, so there is no curative treatment for HIV or AIDS. So there is no curative treatment for HIV and AIDS. No curative treatment. No vaccine is available for HIV. If the child become infected, early diagnosis and management should be for the problems and opportunistic infection. So if the child become infected, early diagnosis and management should be for the problems and opportunistic infection. Specific supportive management should be provided. Nutritional support and management of the diarrhea, fever, cough, pain, etc. So nutritional support should be provided to the child. And TB, pneumonia, herpes zoster, it should be treated accordingly, and family counseling is given. Next we'll see the treatment. What are the medical treatment? Means the drug choice. The specific therapy with antiretroviral drug is used. Those are following like zidovudine, stavudine, lenivudine, and some are the drugs. Those are named as a protease inhibitors like ritonavir, indinavir, and sequinavir. So these drugs can suppress the HIV but cannot the disease. Means this can be the suppress the HIV but cannot cure the disease. Next we'll see the nursing interventions. So what are the nursing interventions? You can see by your own right. Risk for infections related to immunodeficiency state, altered nutrition related to anorexia, pain, abdomen and malabsorption, altered oral mucosa related to stomatitis or candidiasis, diarrhea and dehydration related to enteric pathogens and infections, altered body temperature more than normal due to the HIV infection, and fear anxiety related to diagnostic and treatment procedures. Now we'll see the prevention, how we can prevent the HIV. So prevention by health educations to control HIV, antiretroviral treatment with combination therapy, specific prophylaxis for specific manifestations like for the TB for isoniazid. Means for treating TB we are using isoniazid. Specific management or specific treatment. Parent to child transmissions can be prevented by the avoiding unsafe sexual intercourse, avoidance of commercial blood transfusion, sterilizations of the syringes and needles before administering any kinds of drug or transmissions of the blood to the child, promoting community awareness about transmissions of the HIV infection. Now, so I have discussed very fastly. If you are having any kinds of doubt, mean you can pause the video and you can check it whether where you are not getting clear. Okay, so very thank you.